In science, credit goes to the man who convinces the world, not the man to whom the idea first occurs. That's a quote from Francis Galton, a British polymath from the Victorian era. He was credited with developing the statistical concept of correlation and widely promoted regression toward the mean, which essentially is saying everything evens out eventually. Which, when we look at today's topic, fits rather unexpectedly. In today's video, we learn about and celebrate National Immunization Awareness Month by telling you the story of the first vaccine in recorded history. The first vaccine was created to prevent the spread of smallpox in the late 18th century. But there's a rich history of prevention and treatment methods for smallpox that led to this vaccine, which, let me warn you, is not for those with a weak stomach. Smallpox is both a very old and a very deadly disease. Evidence of the spread of smallpox has been found in ancient societies like Egypt, Asia, and India. Since smallpox has been spread among humans for so long, humans have known how to become immune to spreading the disease for a very long time. As early as 430 CE, survivors of smallpox were expected to nurse the sick because they were not likely to contract the disease again. A practice called inoculation was likely practiced in Africa, India, and China well before the 18th century. Smallpox inoculation was the practice of piercing a pustulate or a boil with a sharp instrument, then using the instrument to cut into the skin of a person who was not immune to smallpox. It goes without saying, but this was not remotely a safe practice. Occasionally, the person who had smallpox was also infected with illnesses like syphilis and other blood-borne diseases, and these could be spread to the person receiving the inoculation. In 1721, Lady Mary Wortley Montagu is credited with bringing inoculation to England after witnessing the practice in Turkey. The next breakthrough happened in 1774 when Benjamin Jesty showed that the previous cowpox infection could prevent smallpox. Jesty had heard that milkmaids previously infected with cowpox were less likely to contract smallpox. Jesty inoculated his wife and sons with matter from the cow infected with cowpox during a smallpox outbreak to protect them. Can you imagine? Your spouse or parent comes home one day with the ooze from a sore on a cow and they tell you, "I'm going to give you a small cut and put this ooze into your now open wound." I don't know about you, but I sure wouldn't be too happy about that. Luckily for everyone who has ever received a vaccine in today's day and age, I wasn't Jetsy's spouse because his wife and sons were the first successfully inoculated cases. More than 20 years later, in 1796, Edward Jenner adopted and popularized the practice of inoculation with cowpox with the intent to eradicate smallpox. Jenner also renamed the practice of inoculation. Inspired by the Latin word for cow, vacca, and the Latin word for cowpox, vaccinia, Jenner decided to call this new procedure vaccination. Since then, the world of vaccinations came to a bit of a standstill, at least until Louis Pasteur successfully created a vaccine for rabies nearly 100 years later in 1885. The next major breakthrough of vaccinations was during the Spanish influenza in the early 1900s. After these successes, vaccines were developed faster and more often. Today, the Advisory Committee on Immunization Practices, the ACIP, helps to direct the time frames for all immunizations. Healthcare practitioners, including public health, follow the guidelines created by the ACIP for routine vaccines. During outbreaks like COVID-19 and Mpox, the ACIP will create new guidelines to prevent diseases. While you're all well aware of the frequently changing guidelines for COVID vaccines, you might be interested to know that Two Rivers Public Health Department has also been following the changing guidelines for another vaccine. Jynneos is a vaccine used for the prevention of smallpox and now monkeypox disease in adults 18 years of age and older determined to be at high risk for smallpox or monkeypox infections. Two Rivers Public Health Department has been using Jynneos vaccine since last summer to prevent the spread of Mpox in our district. Interestingly, a single dose of this vaccine can be split into 5 doses to prevent Mpox. Jynneos can be injected into the fat layer under your skin, which is intradermal, or below the epidermis layer of your skin, which is subcutaneous, depending on the amount of vaccine that you might receive. Monkeypox outbreaks did not affect Nebraska as much as other parts of the country, but local health departments in Nebraska continue to work together to prevent Mpox outbreaks.